Have you been diagnosed of a UTI and have you beaten yourself, asked yourself questions about what you did wrong to make you get a UTI? Don't worry. Today on the TDJ show, we are going to talk about UTI, everything about UTI. Stay tuned, don't go anywhere. Don't forget to comment, to subscribe, and to follow. UTI is actually the short term or the acronym for urinary tract infection. Now, what is a urinary tract infection? It is a symptomatic presence of microorganisms in your urinary tract. Now, big English, let's break it down. So, if you have an inflammation or an infection of your urinary tract and you are manifesting the symptoms, we are saying that you are symptomatic. So sometimes somebody can have the infection but not showing symptoms, or can have microorganisms in the urinary tract but may not be showing the symptoms. But when you are having the symptoms, that pushes you to come and see us. We say you have a UTI. Now, it's a broad, term because it covers all the urinary tract system. Now, the urinary tract is made up of your kidneys, the ureters, the bladder, and the urethra. Now, this system is what produces urine. So the kidney will filter your blood, and then it goes through this process, and then we make your urine. So any infection of any part of the system gives you a UTI. So if you have an infection of just the urethra, you have urethritis. If it is of the bladder, you have cystitis. If it is of the kidney and the urethra, you have pyelonephritis. Yes. So some of them have the same manifestation, but there are a bit of differences that will make us see whether you have pyelonephritis or a cystitis or a urethritis. Now, how common is a UTI? It is very common, and about 50 to 40% of women may have experienced UTI in their lifetime. Some have it even repeatedly, some relapse, some have recurrence, and things like that. Now, let's categorize it. So when it comes to babies or infants, usually, especially in the first 6 months of life, the male babies are more prone due to certain conditions like the PUV and others. You don't want to go there, but male babies are more prone to UTIs than the females. Now, as we grow and we mature, females are more prone. For a man or a male to get UTI, usually it's about 0.04%. But women, we are at risk of getting UTI, but as we grow in age, become elderly, then we see men getting UTI due to certain changes that may happen due to prostate diseases and things like that. So why the changes? Why the differences? Now, let's take the women. Women, what makes us get UTI is because of our anatomy. So for us, our urethra from the bladder is very short. It's about 4 centimeters. For the men, you see how long the penis is. Yes, their urethra is very long. Because of that, it is easy for infection from our genital area to move up, quickly, easily, and move up and cause an infection. Another thing is when you take contraceptives, it puts you at risk. Pregnancy, the weight of the baby and the hormonal changes also put you at risk. So when you see most pregnant women battle with UTI, don't worry, it's not your fault. It's the anatomy and then the hormonal changes. Now, let's leave these and go to the causes of UTI. I'll marry it with why we are having, this variety and then the changes of UTI. So for you to have the UTI, you, the human being, you would be there, and then the microorganism will be there. So for a woman, for the adults, your sexual habits, because the vulva is very close to the urethra, our sexual habits usually predispose us. For the men, as we know, the penis is very long, so it's different for them. For us, it's very short and it's very close. So our sexual habits puts us at risk of getting, using our hygiene. So how we clean the place, whether we are cleaning from front to back or back to front, puts us at risk. So for every woman, you should clean from front to back, because if you do back to front, you are bringing bacteria forward from your anus forward, and then it will put you at risk of UTI, use of washroom and all that. So our hygiene and sexual habits are one of the major ways we can get it, but then we are at risk, like I said earlier, because of our anatomy and things like that. Now, when you are immunocompromised, that is, your immune system is low, maybe you have HIV or you have diabetes or other things that brings your immune system down, it puts you at risk, because anybody who is immunocompromised easily gets disease. When you have diseases of your urinary tract system, it makes you easy, like renal stones and abnormality of your system, it puts you at risk of getting it. If you hold urine too much, then you allow the bacteria to stay there and colonize the area and gives you the infection. If you don't drink a lot of water, all these things put us at risk. And then how virulent the organism too is. So some of the organisms are very virulent, they are very bad, and then with all these things, we end up getting urinary tract infection. And then for the elderly, usually the immune system goes down. For the men, when they grow, because they start getting diseases of the prostate and things like that, that's what makes them predispose the men. So you realize the men start having UTI after 45, 50 years of age because of issues with the prostate. As for the elderly, so when we have the elderly people, it's both men and women. And for the elderly, usually they wouldn't show symptoms, especially for when they come to the hospital, we investigate, then we know that they have a UTI. So now, how do you know you have a UTI? So you realize that when you go and use the washroom, you have a bit of pain or discomfort, or you are urinating more than usual. You wake up at night to urinate. Sometimes you cannot even hold your urine. This is true for the urethritis and the cystitis. But then for the cystitis, that's inflammation of the bladder, you realize that sometimes you can even see blood in your urine. Now, as it moves up to pyelonephritis, to involve your kidneys, you'll be having fever, you'll be having chills, your tummy may hurt, you feel very, very sick. But then you may have the other symptoms like pain on urination, urinating frequently, and as such. Now, how does it spread? So I've spoken about how your hygiene, so that is an ascending infection. You're getting the infection from up down. You can also have infection from your blood, because if you have sepsis, an infection of the blood, it can go to your kidney, and then that way it can spread for you to get a pyelonephritis, which is also a form of UTI. We have a spread through our lymphatic system, and we have direct spread. Let's say you have a disease of your uterine region, a female, you have a disease called a PID. So PID involves your tubes and then your womb. Because it is very close to your bladder and others, the infection can spread directly to involve it. So these are various ways you can get a UTI, but the commonest is the ascending infection, where the infection comes from down up due to, like I said, your hygiene and then your sexual activities. So what do you do when you have a UTI? When you have a UTI, you go to your doctor. You tell your doctor about the symptoms. The doctor will ask you several questions so that they can distinguish between the parts of the tract where the infection is coming from. The doctor will examine you, and after the examination, we'll make you do a series of tests. Most importantly, we may do a urine test. We may culture the urine to get the exact organism that is causing this infection. Now, based on your presentation, you may do some blood work, you may do a scan, you may do other things, because the doctor may want to rule out certain diseases or certain underlying factors. Now, after confirming you have a UTI, usually it's easy to treat. It's because it is most of the time a bacteria. We give you antibiotics, and then the duration will depend on a lot of factors, and also your culture will determine the right antibiotics that should be given to you. Now, what do you do in order to prevent UTIs from happening? One, check your sexual habits. You should be very clean. Make sure you wash down before and sometimes too after, if you can help it. And then your hygiene, how you clean, how you take care of your panties, how you use your washroom, they're all very important. Don't hold your urine. If you have any disease, make sure you treat it, like kidney stones and things like, make sure you treat it. If you have comorbidities that brings your immunity down, like diabetes and HIV, make sure you take your medication so that your immunity is intact. Make sure you drink a lot of water. Don't hold your, and drink cranberry juice a lot, because it acidifies your urine and makes it, difficult for you to get the infection, and actually helps you clear the infection because it makes the urine a bit more acidic. Don't forget to see your doctor when you have these symptoms. You get treated and then abide by what we've spoken about, and UTI will be a thing of the past. Thank you very much. Don't forget to comment, to subscribe, and follow. Thank you.